Depression. We hear about depression all the time, and it is a serious topic. Now, sometimes depression is easy to spot, and sometimes it's not. Not everyone knows what to look for or how to explain what they're feeling. And to notice the signs and symptoms, we can help others and help ourselves. What is depression? Well, depression, to definition, is a serious medical condition in which a person feels very sad, hopeless, and unimportant, and often is unavailable to live in a normal way. Now, it is a very serious medical condition because it makes you not the person that you truly are. It can ruin your whole life and make you someone that you don't want to be. And it can turn into sometimes death by suicide, and none of us want that. So what are the signs and symptoms? Well, some of the signs and symptoms are feeling hopelessness or helplessness, meaning you don't feel like you're going anywhere and you feel down all the time. You don't think that you're going to get better or happy. You just feel like you're no good. Now, you get a loss of interest in daily activities, things that you normally would like to do, such as go to the park or go hang out with friends or just go to the mall, even go to work or school. Those little simple activities that you usually do every day, you don't want to. And that is a sign of depression that you need to look out for. You can have a change in appetite and weight. It can be weight loss or gain. It can be eating more or less. Loss of energy, having no energy to even get out of bed. Anger and irritability. You can get very angry at the littlest things, and irritability, someone can just be around you and you just get irritated for no reason. These are both out of character. We usually shouldn't be feeling this way. Reckless behavior, such as drinking and driving, is an example. Drinking too much, doing recreational drugs, or even taking medications that you shouldn't be. Doing these things is putting yourself and others in harm's way. So, what are the different types of depression? Since we know the signs and symptoms that we can look for, there are 3 different types of depression out there, and many more once you get into it deeper. But the 3 top ones, first is major depression. This is the most, the worst of them, actually. And having major depression, it can be constant. It lasts about 6 months, and this is a long time to be in a depressed state. Some experience a single episode, but more commonly it reoccurs. People who suffer from major depression will suffer from this over and over again. It's recurring. It doesn't go away. It will be there for months, and then it will go away for a little while, and then you just fall right back to it again. This gives you the inability to enjoy your life as you should. Another type is dysthymia. Now, this is a recurring mild depression. You're not sinking into a depression so deep as major depression, but it's like it's more days than not, you're mildly depressed. Maybe some days you don't want to get up, but most of the time you do. So it can last longer, but the symptoms are not as strong. So having dysthymia, you can feel like you're not depressed, and you can feel like you're just going through a funk, but it is depression. If you don't have interest in things and you're not being yourself, then you should see a doctor, somebody to talk to see if this is dysthymia or you're just not feeling well. Maybe you have the flu or a cold. Another type of depression is bipolar disorder. Now, this is a manic depression. It's cycling mood changes, impulsive behaviors, hyperactivity, rapid speech, and little to no sleep. It's very similar to major depression, but you go in and out more of mood changes. You're really happy one day, and then the next day you don't want to get out of bed. Major mood swings like this and is a type of bipolar disorder. If you see somebody that is fine one day and then the next 2 days they're in bed, and then the next week they're happy, and then the next week after that they're right back to acting really weird and keeping to themselves, not talking to anybody. It's a type of depression. It could be bipolar disorder. So we can find help. Now, we can help ourselves by, you can cultivate supportive relationships. And to do that, you want to turn to friends or family who you may feel loved or cared for by. Talk to them, let them know how you're feeling. Talk to those who will listen. And they don't need to be able to fix you. They don't need to be able to tell you what you should or shouldn't do, but they just need to listen. A good listening ear can help somebody get out of a mild depression. It can help them get rid of whatever's eating away at them. You can try to keep up with social activities. Even if you don't feel like it, you should get up and go. This can help you bring you out of the state of depression by making you realize that you can still have a good time and be around those who are fun and make you smile. Or you can even join a support group. This can reduce the sense of isolation and help you give and receive advice to others in the support group to help you pull through it. You can also go and see a doctor. Doctors will help prescribe medicines. They often do. Medicines can help. It usually helps many people. Some examples of medicine that they prescribe is Wellbutrin, Prozac, Abilify. That's only some, and there are many, many more. But these have been proven to help those suffering from depression and helping them get back to their normal everyday life and being happy. Another way is finding friends, doing fun things. If somebody is easy to talk to, you should find that person, go to that person. There's also, in England, they came out, and maybe even they'll bring it over here. There is an online group called Uploading Depression. Now, this is an online help center because not all of us like to admit that we're depressed. We don't want to go to somebody and say, hey, I'm depressed, you know? So doing this online, it's called Joyable, and being computer-based, there's no waiting. You can avoid the stigma attached to seeking medical help for being depressed. You can get help right away. Most of the time you're waiting, you're on a list to see a doctor a couple weeks out. And you don't want to do that. So this program allows more flexibility, and it has psychotherapeutic treatment, and it helps patients understand the thoughts and feelings that influence depression so they can better help themselves. This also provides counseling, and you can talk to other people on this site to be more connected and on your own time and your own schedule, however you feel comfortable. The program's called Joyable, and it has been very successful over in England. So hopefully they can bring it over here. Now, depression is serious, and I hope that you now have a little insight on how to see depression in others and in yourself, and hope this helps you. If you are suffering depression, you can find a way to get out of it.